If you've had a kidney stone and now keep getting UTIs or even UTI-like symptoms, this is actually pretty common, and I want to talk more about what you can do to prevent them. Hi, I'm Dr. Jasmine Bonder. I'm a critical care nurse practitioner, and we're going to be talking about post-kidney stone UTIs, why they happen so often, why symptoms can linger even after the stone or the couple stones are actually gone, and hopefully prevent this from actually becoming a cycle. So let's talk about why UTIs are common after kidney stones. Kidney stones don't just cause pain, even though they're super painful, they can disrupt the entire urinary tract. And here's why infections often follow. Stones irritate the urinary lining. As stones move, they can scratch and inflame the ureter and the bladder. It can disrupt the protective mucosal layer, and it can create microscopic injury that really irritates the tissue and becomes more vulnerable to bacteria, even just regular normal bacteria. Stones can actually harbor bacteria. Some stones, especially struvite stones, can trap bacteria within their structure. And they can act as a safe house where antibiotics really can't penetrate. So even after antibiotic treatment, bacteria can persist and cause this reoccurrence. Urinary stasis after stones can cause this pain, swelling, or even residual obstructions that can lead to this incomplete bladder emptying. So you pee, but it's not completely emptying. Slower urinary flow, or even residual urine that is sitting in the bladder and staying stagnant. It is a great breeding ground for bacterial growth. So medical interventions also can increase risk for stents, for catheters, lithotripsy, and even though these are necessary, they can introduce bacteria. It can disrupt the urinary microbiome, and it can trigger this post-procedural inflammation. So not every post-stone flare is infection, but symptoms can feel really identical. So you may ask, why are my symptoms persisting and I don't even have an infection? And this is important to talk about because many patients continue to feel this burning with urination, urgency or frequency, pelvic discomfort, even with negative urine cultures. Now, why? Bladder hypersensitivity, post-inflammatory irritation, nervous system sensitization. And this is often not a new UTI, but it feels like exactly like one that isn't going away. So treating these episodes with repeated antibiotics will actually worsen long-term symptoms. So what are the prevention strategies that actually help? Hydration is non-negotiable, and consistent hydration because it can dilute the urine, it can reduce bacterial adherence, and it can prevent other stones from reoccurring. So you really want to aim for light yellow urine and not clear and dark, and make sure you have a good stream. You want to address the stone type and prevention, which changes based on the stone composition. So if it's calcium oxalate, it can be uric acid, it can be struvite stone. These type of analysis will really guide, number one, what diet changes need to happen, urinary pH management, if there's some supplement need to be used. And so guessing here can lead to repeated stones and repeated UTIs. So what are some supportive and bladder and urinary defense? Well, that really depends on the patient, and it can include a variety of things like urinary antiseptics when it's appropriate, like methenamine hypurate, or non-antibiotic UTI prevention strategies like cranberry seed extract, or restoring healthy urinary and vaginal microbiomes like pre and probiotic. And I think that's a pretty important one, especially after people have been using antibiotics. And then really avoid over-treating symptoms. Not every flare needs an antibiotics, and helpful alternatives for non-infectious flare may just be increased fluid. So drink 6 to 8 glasses of water a day. Aim for that pale yellow urine. A bladder-friendly diet, and anti-inflammatory support, maybe like an NSAID, pelvic floor relaxation, and really to start, confirm an infection before we actually treat with an antibiotic or an antifungal. You want to manage post-stone bladder sensitivity, even if it's temporary, but it's pretty common after stones. So we really want to advocate for avoiding any type of bladder irritants, so any type of hygienic products that are irritant, coffee, alcohol, acidic drinks, gradually return to a normal diet, and pelvic floor physical therapy, especially if symptoms are persisting. This step alone can prevent months of unnecessary antibiotics and hopefully reduce symptoms. So really, I want to talk about final takeaways. If you've ever had a kidney stone, first of all, I'm so sorry. I know they're super hurtful and painful. UTIs afterwards are actually so common, but not inevitable. Symptoms don't always mean infection, so make sure you have a positive culture or identifiable pathogen. Prevention works best when it's personalized and proactive, so breaking the cycle early protects both your bladder and ultimately your gut microbiome and your healthy vaginal microbiome and all the microbiome we want to maintain. Hopefully this helped. Please like and subscribe for more urinary health education and share this with someone. Everybody knows somebody who's recovering from a kidney stone. And remember, you deserve prevention and not just prescriptions.